support the Trust and its 5 hospitals. One of the things we're most proud of is the support we give for the staff of the Trust, and the Make a Difference Awards is one of those ways. NHS charities are there not to cross-subsidise government work, but actually to pay for a lot of the stuff that the government wouldn't fund. We also fundraise for specific appeals, so we've got one at the moment for the Queen Charlotte's Birth Centre, and we're raising £2 million for paediatric intensive care.
The Trust is really pleased for the vital support that we get from the charity. The charity helps us fund things like service and capital developments. They help us with our staff reward and recognition programs, and they also help support us in terms of translational research. So I'd really like to encourage all staff to really get behind the charity's efforts in these fundraising appeals. Without the vital work of the charity, our services would not be as strong as they are today.
I'm a mother of a child who's got sickle cell anemia and has been under the care of St. Mary's. He's had multiple hospital admissions, including an ICU admission. We decided as a family to fundraise as a way of appreciating what they've done. We've done a family and friends coffee morning. We've done a Bupa mile run, a lunch at a restaurant where they contributed towards the collection tins. Our future plans as a family is to continue raising money because we believe that what they're doing is quite vital. In conditions like sickle cell where there's no cure, you really need a charity like that.
I work in children's services, and I have approached the charity's Dresden Hardship Fund to obtain funding for parents who are finding it financially difficult when they're in hospital with their sick children. They sometimes find themselves in a hospital in London. They may have lived out of London and arrived just in the pyjamas or the clothes on their back. So I've approached the charity for funding so that they have clothes to wear, food, they can afford travel for other family members to come and see them. It's made such a big difference that just a little bit of money makes such a big difference to the families.
I work for an organisation called Standing Together, and we're a domestic violence charity, second tier, and we received some funding from the charity to implement some domestic violence work in A&E. We wanted to employ an IDVA, an independent domestic violence advisor, as a way for A&E staff to refer any cases of domestic abuse directly into this IDVA. Since the project started, we've had 67 referrals, which is quite significant, I think, in sort of a 9-month period. We're able to support them in safety planning, reducing their risk, linking them in with housing services. It can be often the first point of contact. So I think it's really important work.
I'm a midwife at St. Mary's Hospital, and in 2013 I was awarded 12 months research fellowship. I used this opportunity to do a pilot study on clinical handover on labour ward. All the data I collected show that there is space for improvement and formed the basis for my proposal for a NIHR clinical doctoral fellowship. I would encourage other frontline staff to apply because I think it's a great opportunity to introduce member staff to research, not for the sake of the research itself, but as a way to improve patient safety and patient experience during their stay in hospital.
Most of my work is based in patients' homes and schools, where I do lots of training and teaching to empower people to look after their own diabetes and also those who take care of them. It's the real life, day-to-day stuff that they deal with. So working with them at meal times and teaching them how to calculate their insulin doses based on the foods that they're actually eating, going into their homes and seeing the way that foods are prepared and where they're served and how they're served. We also run training days which are open also to members of staff from other hospital trusts as well as school staff. Without the funding from Imperial College Healthcare Charity, this project wouldn't have been possible at all. And it's no exaggeration to say that it has transformed our entire service and the management of our patients.
We are delighted to be fundraising for such a fantastic organisation and to be supporting staff, patients and relatives with their own fundraising activities. If you would like to get involved in supporting the charity and help us raise money for our hospitals, then please get in touch with our team or visit our website. Details are in tonight's programme. Thank you, we couldn't do it without you.